Chapter 15, Communication Strategies for Stroke Survivors and Caregivers. Communication is at the core of our human experience, allowing us to express our thoughts, needs, and emotions. However, a stroke can sometimes disrupt this ability, leading to a condition known as aphasia. Despite these challenges, effective communication is still possible. This chapter explores effective communication techniques, strategies for caregivers, and assistive communication devices that can support stroke survivors with aphasia. Effective communication techniques. Life after a stroke may alter how you communicate, but there are several techniques that can support stroke survivors in expressing themselves and understanding others more effectively. Use simple language. Employing simple words and sentences can facilitate easier communication. For stroke survivors with aphasia, conveying your message in the simplest way possible can be helpful. Likewise, when communicating with a stroke survivor, using straightforward and clear language can ensure your message is understood. Nonverbal communication. Nonverbal forms of communication, including gestures, facial expressions, and body language, can aid in conveying meaning when words are challenging to produce. Visual aids. Utilizing images, drawings, or written words can assist in expressing ideas or concepts that are difficult to articulate verbally. Patience. Allow yourself or your interlocutor time. Communication may take longer than it did prior to the stroke. Be patient both in expressing your thoughts and in comprehending what is being communicated to you. Rephrase when needed. If you struggle to understand something, ask the person to rephrase it. Conversely, if you find it difficult to express a thought, try reframing it or using different words. Strategies for caregivers. As caregivers, your role in the recovery process is crucial. Here are some strategies that can enhance communication with stroke survivors. Active listening. Provide your undivided attention to the stroke survivor when they speak, demonstrating empathy and providing feedback. This can make the person feel valued and understood. Speak clearly and slowly. Use simple words and phrases, speaking at a slower pace to give the stroke survivor time to process your words. Encourage expression. Encourage the stroke survivor to communicate in whichever ways they find easiest, be it verbal communication, gestures, drawing, or using assistive devices. Validate feelings. Acknowledge and affirm the stroke survivor's feelings. It's crucial to provide emotional support, as communication difficulties can be frustrating. Inclusion in conversations. Include the stroke survivor in conversations and decisions, particularly those that involve their care and daily activities. This fosters a sense of respect and involvement. Assistive communication devices. Assistive communication devices can provide significant support for stroke survivors with aphasia. These devices range from simple picture boards to sophisticated electronic devices. Picture boards. Picture boards, with images of common items and activities, allow the stroke survivor to communicate by pointing to the relevant image. Communication notebooks. Notebooks that include common phrases, names of family members and friends, and images can help a stroke survivor indicate what they wish to communicate. Speech-generating devices. These electronic devices can vocalize a selected word or phrase. Advanced models can even be programmed with personalized phrases and voice options. Smartphone apps. Numerous apps can assist with communication. These apps can convert text to speech, provide symbols for sentence construction, or offer pre-programmed phrases. Finding the right communication method varies for each individual. Collaboration with a speech-language pathologist can assist in identifying the most suitable option for your specific needs. By using simple language, nonverbal cues, visual aids, and by taking your time, you can enhance the way you express your thoughts and understand others. As a caregiver, your role in the communication process is vital. Active listening, clear speech, encouragement, validation, and inclusion of the stroke survivor in conversations can significantly impact their recovery. Assistive communication devices can also offer valuable support. Whether it's a picture board, a communication notebook, a speech-generating device, or a smartphone app, these tools can add an additional layer of support in communication. While communication may look different after a stroke, it isn't lost. With patience, perseverance, and the right strategies, stroke survivors and their caregivers can continue to connect and understand each other in meaningful ways. Please note, the communication strategies and assistive devices discussed in this chapter are general suggestions and might not be suitable for everyone. It is highly recommended to consult with a healthcare professional or a speech-language pathologist to receive advice tailored to your specific needs and abilities.